Okay, good afternoon, everyone. Welcome to the Southborough Board of Health meeting on Tuesday, November 14th, 2023 at 12:30 p.m. It is 12:35 and I'm calling the meeting to order. We have 2 out of 3 members present right now, and I'm sure Dr. Medina will join us when he can. Okay, so first, and this is a Zoom only meeting. First, we'll do public comment. So if anybody has any public comment, feel free to raise your hand in the Zoom room. No public comment. Okay, so approval of the minutes of the 10/10/23 meeting. Any changes to those?
Nope, they look good on my end.
Okay, I thought they looked good as well. So I'll move that we approve the 10/10/23 minutes.
Second, and I vote yes.
Okay, Malinowski, yes, thank you. Okay, vote to request the personnel board to reconsider classification of business administrator 1 job description and addendum. So when we had met last time, we had, per the personnel board's request, modified the format, I guess, for the job descriptions. And just for a little background for you, Liz, business admin 1 and business admin 2, I think are the only 2.
I was there. I was at the last meeting and we talked about this.
We talked about that there's multiple people in that one. Okay.
Yeah.
So
and how what the difference is just like the addendum or whatever they called it.
Okay, great.
Yep.
Okay.
I'm like, I'm with you.
All right. Great. Save me some breath here. So I went to the personnel board chair to request a reconsideration of our job description now that the addendum is included. I did not get very far. So I went back and looked, and in the last, let's say, 8 to 13 months, there have been a few reconsiderations for reclassification as Collins Center was going through this whole process, and there were several aspects that they looked at, one of them being interviews, which Barbara was interviewed during that time, one of them being them looking at addendums, at least from what I can tell from the minutes. So some business admin 1s, business admin 2s, and at the time admin assistants were reviewed for reclassification. Some were moved, some were not, and included addendums. Now, at the time, I think the only piece that Barbara's position had been reviewed for was the interview, and I'm not aware of any request to create an addendum was made to the Board of Health until this fall, when we don't have Collins Center doing their reclassification review. So my request to personnel board was that we be fair, and for any, for the position that we're representing, that we at least get the consideration of having a review, where other positions or other people in the same position were reviewed with an addendum. Some moved or some reclassed, some not, but at least it has the perception that if they were to review it, that it would be fair across for all the employees in that position. So, and Heather, you're not aware of any requests that we would have received to do an addendum last spring or last winter? No,
so, that was only this spring we started getting requests from the board about
and I think it was
job descriptions. It was more, right?
So I thought, rather than continue to go back and forth on my own, I'd rather have the support of this board of making a very specific request to personnel to be included on an agenda for consideration of reclass for business admin 1 for Board of Health with the addendum.
I think that makes sense.
Yeah. Okay.
It's the fair way to go about this. So.
Okay. And I understand, like, we're not in the realm of reclassing jobs. Like that's not our role. But I think, with having this addendum, and that's the differentiating factor between the people in those positions, then I do think we should advocate for having that. So, okay, so I'm going to move that the Board of Health request to be put on a personnel board agenda to consider reclassification of business admin 1 job description and addendum.
Second, and I vote yes.
Okay, and just before we vote, I just have one other comment.
Oh.
So we do need to, and I've talked to Barbara about this, we need to be prepared to explain what has changed between kind of the interview and the addendum. And, I wasn't part of the interview, but I think even in that meeting when we were brainstorming, like we had no input into anything up until that meeting that we had on the addendum. So I think even then we came up with some different things that we know that she does. So I just think it wasn't as broad of a scope as it should have been. Okay. So
Yep.
Malinowski, aye. Okay. New body art establishment, Taylor.
So I just wanted to make the board aware that we had an application for a new body art establishment. They're doing microblading. I went and did their inspection last week, 2 weeks ago, and everything looked great. So their permit should be going out this week, but I just felt like it was something just that the board should be aware of. So everything looked good. There's no concerns.
Right. How many establishments do we have in town now for body art?
2.
Okay. Okay.
Both are microblading.
Great. Well, welcome to town, to them. Okay, body art regulations.
Which brings us to our next one. After reviewing our regulations, I feel as though they need to be redone. There was a lot of things in the regulations that I needed clarification about. A lot of it also revolving around the language in it. A lot of the language was more referring to the board and not the inspector. So, for example, it would say if the board may choose to do this and like to approve. So it's not the board that approves it. So I would just like to look into them and kind of see what other towns' regulations are, and most likely just fix them so that they make more sense for what we are actually doing.
Okay. Great. Any questions on that? Okay. Thanks, Taylor. Oh, cool. Okay. Opioid settlement funds. So this is one that we're just going to keep on the agenda every month. And I don't have an update, but we will be requesting a warrant article for that for town meeting.
Yeah, I did see we have a new updated town meeting date and time.
Yes.
So now
Yeah.
at least know March, that we have that date in March, right?
Right.
Yeah, the week before.
Mm-hmm. Because they originally had.
Yeah, unfortunately, I will not be able to attend the new date.
Okay. Okay. Deputy Emergency Manager recommendation. So, Liz, you may know this or you may not. I think it was before you were on the board that the board supported Taylor getting more involved in emergency management with Fire Chief Achilles. We thought that there was a great need to have somebody who wasn't necessarily frontline public service between police and fire. So, thinking about any sort of disaster that happens, making sure that we had a resource that didn't actually have to be, out in the field, somebody that could be at the public safety building and available to run point there. So Taylor's been over the last year,
Almost a year, yeah.
has been going to classes, attending trainings, working with the fire department on plans. And I think from all aspects, it's been a positive decision, and that people have been really happy with how it's been moving. Taylor, do you have anything else to add before I keep going?
No.
Okay. So a week ago or so, I got an email to myself and Mark Purple from Fire Chief Achilles requesting that Taylor be appointed as the Assistant Emergency Director.
Deputy Emergency Manager.
Thank you. Which is an actual title, which I should know. And currently, I believe it's Chief Newell. And I think, you know,
Currently we don't have one.
oh, okay. It was the old police chief though.
Correct.
Okay. And I think with kind of what is needed, it makes a lot of sense to have Taylor. Now, I'm saying Taylor as a person, not Taylor's role, right? Because I think anytime you tie a position like that to an actual role, except for if it's like the fire chief, I think you can get it doesn't necessarily go with the role, but I think for this scenario, it fits really well. So that's why we're not tying it to Taylor's job description. But I think for our setup right now, I think this makes a lot of sense to have somebody outside the fire department and outside of the police department. I don't think that that we're losing anything by not having a police member as part of this.
Also, it's worth noting that everyone in the fire department was asked if there was interest, and as well as key people in the police department, and they were happy to pass along the role to someone different.
Yeah. It's not our appointment to make. However, Taylor and I talked, and we thought it made sense to get the blessing of this board, so that when this is before the select board, that they know that we're supportive of this. And I think for the first year, we need to see how it goes, and, you know, make sure that Taylor's able to work the hours that she needs to for that, as well as her the current role. I mean, I don't know that it's going to increase a lot compared to what she's already doing, but I think it's something that we need to continue to watch to make sure that she is fairly compensated for the position.
So I don't know, Liz, if you want more elaboration on that or not. You tell me.
No, I think it makes sense. I know you talked about this, I think previously, and like setting up command centers for like this is all related,
Exactly.
right? Yeah. So
Basically it's a lot of planning in the, you know, off days that there's nothing going on, which we as the health department should be involved in anyways for the most part, because a lot of disasters in town also include the health department, so it's kind of overlapping.
Yep.
The only area that it would be, you know, is different, you know, we'd have to get the pay from not the health department budget. It would be is if we were having like a long-term disaster in town that I would need to spend multiple days in the emergency operations center.
Okay.
Which could be reimbursed by FEMA, right?
Correct.
Okay. So I think that's kind of where we need to be flexible and figure out, you know, just make sure that we have open communication between Taylor and the fire chief on what they
It's
need.
worth noting that in the past 3 years that I've worked here, we opened the emergency operations center one time just for like 4 hours. So
Yeah.
Okay. So I'm going to move that the Southborough Board of Health support appointing Taylor to the Deputy Emergency Manager position.
Second, and I vote aye.
And Malinowski's aye. Thank you. Okay. Greater Boroughs nursing staff. So I don't know if you ever had the chance to meet Erin, Liz. She was a nurse in Northborough. You probably didn't.
I don't think so.
She was a Salmon employee who the Greater Boroughs contracts with for nursing time through the PHE grant. And we had her for,
2 years.
yeah, and she was great, and she left, which is
So
really.
she was a full-time employee shared between Northborough, Southborough, Boylston.
Yeah,
That I worked very closely with, and unfortunately she left at the end of October. So there is a vacant position to help support Southborough in nursing services right now. And we're trying to work out the details of reposting.
So it's sad for us because it was a great resource for our staff, and to work collaboratively together. And Taylor and Erin did the CPR training and a lot of the Narcan training.
Yeah.
So it is, even though it's through the grant and on Northborough, blah, 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 it really does impact Southborough. She was nice enough to stay on until our flu clinic was over. So she would come, she'd come to Southborough whenever we had a need. And, we're just hopeful that whoever replaces her, can kind of jump in and be as collaborative as she was. So we thank her for her service, to the town. And, I know Taylor especially will miss her, but I think I speak for everyone in town, whether they met her or not, she had some impact. Okay. Flu vaccine update. Taylor?
Flu clinics were really successful. I have a handful of vaccines left that I created a flyer for yesterday and plan on starting to put up over town in public places. Basically, it just says by an appointment basis, please call me, and you can still get your flu vaccine if you haven't had one yet. We have mostly high dose vaccine left, so for the population of people ages 65 and older, they would be able to call me and just come in for an appointment. And then I'm hopeful that in the next 2 weeks, we'll be able to use up all of those vaccines and we'll have another successful flu clinic season.
Great. And when do we have to order for next year?
February.
Okay. And in terms of the reimbursement schedule, do you think it's going to be better than it has been, or do you have any indication?
Yes. So this past year, so for our 2022 season, and maybe Barbara has a better idea, but I get emails just saying we were reimbursed. And it seems like we've gotten a very large amount of money. So
Okay.
I don't know if Barbara still can't hear or.
No, I can hear, I just can't talk. No, I mean, yeah, we have, the immunization fund was really good this year, so hopefully,
Yeah.
But we don't start get reimbursed until the end of next year.
Yeah.
Okay. And you think you'd reorder the same amount for next year?
Mostly, yes. I'd probably play around with it a little bit, but like 10 vaccines in either direction, which is what I did this year.
Okay. Great.
You can never predict who's going to be interested and who's not. So,
Right.
last year, it's just, I found it interesting, just in case you're interested too. Last year, I went to the schools for the first time and vaccinated school employees, and I vaccinated about 40 school employees throughout all 4 schools. And then this year, I went to the schools and I vaccinated almost 120 staff members. So,
Whoa.
big, huge difference.
That's awesome.
So you never can predict what.
Do you think people didn't know about it last year, or they had already done it before they found out?
I sent the email out to Mary Ellen to distribute the same day, exact same day. So,
Oh, interesting. Okay.
and the clinics were the same days as last year. So not sure what the difference is, but
like once you know your work provides that you like wait for your work to provide.
Yeah, that's
I
true.
always do. Yeah. So
yeah. And we had a lot of people too. We did a couple things different in the schools this year too. Like we made announcements about having extra vaccine, and like to Liz's point, I think the convenience factor of having it there, like had a lot of people come in just being like, well, since it's here, like I would never get it otherwise, but because it's literally at my work, I have no reason not to. So
Yeah.
it was good.
That's awesome.
Yeah.
I didn't realize the jump in participation. I did get great positive feedback, but I didn't realize that you tripled in the
Yeah.
amount you gave.
Just for school staff, but I
Yeah.
would say in general, like everywhere else, numbers were much lower.
Okay.
Hmm.
Okay. I did hear some people say that they had already gone to their doctor. I think
Yeah. And that's always a challenge, and we're kind of at the mercy of the company that we use to figure out when our vaccine's coming in. Normally, I don't get all of my vaccine until about a week or two before our clinic, so I
Yeah.
can't have it much earlier just in case.
Right. Awesome. Well, good feedback. Thank you. FDA tobacco compliance violations. Heather.
Okay, I just wanted to make you aware of FDA compliance checks. So in Southborough, our Board of Health is inspected through the Tobacco Control District that's funded by the state, and we're in the Metro West region. And I think we had Pari on an earlier Zoom meeting. He does inspections for our Board of Health. He does a kind of a retail inspection to make sure there's appropriate product on the shelf, appropriate manufacturer letters. And then he also oversees a compliance check, which is an underage buyer. Also, for our retailers, the FDA does compliance checks for underage sales. And our retailers also have inspection by Department of Revenue. I think that's a little bit more about charging sales tax. Anyway, what I wanted to make the board aware of is the FDA compliance checks. As you know, we redid the Southborough Board of Health regulations for tobacco. They were implemented a year ago. And with that, we brought up everything up to line with state, as well as progressed with some of our violations, including the underage. Okay, so in January of 23, our tobacco district, which is our Board of Health appointed inspector, did have 2 failures for compliance. And with the new regulations in Southborough, the first-time offender had $1,000 fine and a 3-day permit suspension. Our other failure in January of 23 was a retailer who had failed once prior. You maintain priors for 36 months with tobacco compliance checks with our Board of Health regulations. So for a second compliance failure, one of our retailers had a $2,000 fine for underage combined with a 7-day suspension of tobacco sales. And then, as I said before, I want to make you aware of the other system, which is the FDA compliance checks. The FDA compliance checks are completely unrelated. I've spoken with, our tobacco control district as well as the state tobacco control district, that the FDA, when they do compliance checks for underage, they have their own warning and fining system. It is publicly available. When they do after the fact, all compliance checks are unannounced, but after the fact, in terms of the inspection and the follow-up, either warning or fine/suspension, the FDA does not issue fines until there's been a number of failures. And we cannot use their failures to work into our system where we have our own compliance checks annual. And as I said, we base those based on failures prior. So I spoke with MHOA, who actually was subcontracted this year to do the FDA compliance checks. I think since I've been here, they've only happened a few times, the FDA compliance checks, but my understanding now, talking to MHOA, they are going to send folks out again in 3 to 6 months. They had 2 failures in Southborough this fall. Actually, it was the August 30th this summer. They had 2 failures for their compliance check with underage sales. And MHOA recommended there is no formal process. We cannot, like I said, enforce or have it count towards our regulations. But what they potentially recommended to our Board of Health, if we would like to, is we can invite them to a regular Board of Health meeting. We can invite the retailer and ask the retailer to, discuss the compliance. Obviously, they're aware of it, but to ask them basically as a point of education in terms of what are you doing now? What are you doing now to improve your system for sales to underage youth? Are you, doing training with staff and education, et cetera? So that is our option if our board would like to invite our 2 retailers that failed to probably our next board meeting.
Thanks, Heather. Hi, Safdar. How are you?
Hi, I am so sorry. My last meeting was supposed to end at 12:30, so I thought I was okay, and then it was Heather can talk about long UMass meetings sometimes they can extend.
Yeah.
So
No, that's fine. We figure you got tied up.
Yeah.
So Barbara, for the minutes,
Mhm.
12:57. So Safdar, I think I'll go to you first because you're probably
Mhm.
the most versed in this area. What are your thoughts? So I was actually surprised to hear that we couldn't enforce our own regulations if FDA comes in.
Mhm.
So that being said, what are your thoughts on having the establishment and FDA come in to a
Well, it
regular?
won't be the FDA, it would just be the 2
Oh, just be
establishments,
got it.
just the 2 retailers.
So not anybody that did the compliance check.
Oh, no, not at all.
Got it.
We're not related to that in
Okay.
compliance check at all, but we know who the 2 retailers are. We can call the retailers, the establishment here. That's it.
So just to backtrack, just so I get the story. So with the establishments, what you're saying is that the FDA rules were not as stringent as ours. Is that?
Well, in some ways, I would agree with that. I believe the FDA does their own finding and suspension, and that they don't fine/suspend. I don't know what their fineage or suspension is, but I was told 5 sales in 3 years. So until that time, it's a warning. So these 2 retailers got a warning letter from the FDA in after that failed compliance check. So they're totally aware of it. They got the warning letter, but they did not. The FDA doesn't issue fines.
But the
until-
rules are the same. It's just
No,
the rules
no.
are not the same. But we would
No.
have, if we had a compliance check done by Metro West,
correct. Even on the
would-
first violation, we fine
would
and
have gotten
suspend.
Fine.
a payment to the town,
Correct.
even if it was the 5th violation with the FDA or wherever they actually collect
Well,
payment.
FDA is completely unrelated.
I know, but the payment wouldn't come to us.
No.
Right.
The fine would be on the retailer. It wouldn't come to us, but just of note, the FDA system doesn't fine on a first failure.
No, but let's say
We
it was
do.
one that they would find on, FDA would get the.
Yeah,
revenue back.
they're in their
not
own
us.
system, right?
Yeah.
So basically, these establishments, we've already fined them, but now they're at that FDA
Well,
threshold. No, sorry, I missed that first part. I just want to make sure I get it
okay,
right.
we have our
Yeah.
own regulations.
Right.
Right, and so when we did them a year ago, there's now a suspension even for a first-time compliance failure. And
Right.
then our regulations have a 36-month sort of period such that
Right.
if you have 2 or 3, you increase the fine and the suspension.
Right.
So in January of 23, we did our own compliance checks, had 2 failures.
Mhm.
In August of 2023, the FDA did theirs. And of note, the FDA did 1 in 2022, did 1 in 2019, and didn't do any in 20 and 21. So this hasn't really come up too much. The FDA compliance checks that we're not involved in at all. Other than now that MAHA is subcontracted, MHOA told us about them and suggested what we could do.
Okay.
The MHOA had suggested about potentially we as a board could speak with the owners of these establishments. And by the way, the two that failed the FDA check in August are not our two that failed in January, obviously on a given day.
Exactly.
Right, right. I mean, I have the list personally of who's failed since 2015 with the FDA and with the Board of Health, but that was just my own background.
So then are we, so then.
We don't have to do anything. We're
We don't have to do
completely, we don't have to do, we can choose to do absolutely nothing. It is not, no follow-up required. No
But I think we should.
acknowledgement required. Well, that's the question, right?
I mean, for me, because this is still a violation per what we have
That we're
decided.
aware
even though
of.
we
We've
weren't
been made
compliant.
aware of it.
Yeah.
We've been made aware of it.
That we, even though it wasn't our compliance check, it was
No.
still a violation.
It
And
was still a failure for underage
right.
sales.
And again, our goal is the safety of our town. So this is a clear impact on the safety of our town. So I am in support of it. Absolutely. I think so the question is, so the legal part of it is where I guess I'm struggling with. We cannot institute any fine because we
Nope.
did the compliance check, but I think meeting with them is reasonable and going
Right.
over, because
At what MHOA thought was
Yeah.
reasonable. And I did just kind of sideline our town council thought that was reasonable.
Liz?
Yeah, I mean, I think that makes sense. I'm also surprised that there's like little that we can do, but
Heather, do you know if any towns have adopted as part of their regulations that if FDA has a compliance check?
No, I don't think so. And what was also curious, I mean, Pari's new, but when I asked him, I've talked to him a couple times this fall,
Yeah.
since the August situation. He doesn't know of any other failed FDA compliance in his jurisdiction.
I mean, if possible, I would suggest that we update our regulations to be able to act if
I will
FDA.
look into that. I don't think we
Because,
can. I think
know-
it's a completely sort of different, authority enforcement, right?
I mean, this is, to me, this is a serious
Yes,
problem.
this is an
And we
underage
continue to
compliance
have
check.
This
Absolutely.
happened.
I mean, considering the number of
exacerbate-
I'm just saying that our Metro West Control District, it was 13 towns, now it's 16, so I know that for 2022, when the Metro West, our in compliance checks, I think it was a failure rate of about 5%. But in terms of, we don't have, that's for the region, we don't have that many tobacco license. There's
No.
9 in town, that our
That
failure
two
rate
fails?
is fairly high.
Yeah. And two
So I think
failed
it's a problem here.
separately.
Two separately, actually
had
different
4
folks.
out of 9 failed in the
In
last 12
2023,
months.
within 2023. Yes, that's what I'm saying. It's a
That's-
problem.
That is.
I looked
that is
back at that.
disgusting.
It's awful. It's awful.
honestly, and we can link this to our youth risk behavior survey data. Like, I think this is the perfect thing to link, is here we have
Yep.
the clear infractions and look at our data on our adolescents. Yeah, it's.
Yep.
And speaking of one other thing, on the other inspections, as it mentioned before, is for product, signage, sales price. We up the minimum on a cigar price, etc. So our tobacco control district, on behalf of the Board of Health, does retail inspections. They do, one is sort of more of an education visit, and one, and we did have a new owner, so they had not been prior educated by Olivia and been inspected by Olivia, did have a flavored vape product. That is a huge problem. That is, the state banned flavored products in 2019, implemented in 2020.
At a meeting.
So when we have ownership changes on somebody that has a tobacco license, can we
We educate.
request
Mhm.
Metro West
Mhm.
proactively to go out there and provide the education on what our rules and regs are before they are able to sell.
Yeah, no, yeah, I mean, basically that's what happened. But again, there was, there was a little time frame where we didn't have someone. But yes, it
At
was
Metro
very soon thereafter, right? It was very soon thereafter after they, they're new owners of the establishment. It didn't go for a long time, but right. Yeah,
I just think that if we let things like this slide and don't make establishments aware that we're serious about these violations,
exactly.
then we're hurting our kids.
I agree.
So I mean, there's, legally staffed or no, there's nothing we can do,
Yeah, that was my,
but
yeah.
I think we need to make sure that they know that this is not, it's not acceptable.
So I think a meeting just for that sake is definitely worth
Okay.
it. And then, whatever, happens, but then they are definitely forewarned about our town. Like we can just review everything again with them and say that
Yeah.
we know these things and,
Yeah.
and whether or
Again.
not legally we can change our guidelines is still up in the air. Is town council help us with that, or Heather, or do you have any other context for like DPH that would know what we can do? Other town, no
I
other
can
town.
ask about that. I sense we can't put anything about FDA compliance into our regulations. I'm pretty sure about that, but I can recheck. And also about, change of owner, that's that's more of a,
Operational.
exactly, right. They
Um,
made our district bigger. We now have 16 towns, so.
That's good though. I'm
a
glad
lot.
towns
Yeah.
are
Yeah.
adopting, using them.
Yep.
All right, Mr. Litt has his hand raised. Does anybody else have anything before I allow him to weigh in?
Greetings. I think it's been a while since I pestered you. I was just listening to this conversation and it occurred to me that one thing you certainly can do is send them a letter, a written letter that says, we've received a report of this violation from the FDA. And had we caught you, it would have cost you this much.
That's
then you
already
can't go-
happened. That's already happened in terms of our inspector being there in September and being aware of what had happened in August. So they went through that. Yep.
Well, no, what I'm saying is when you find out that that they failed an FDA inspection, send them a letter that says, we're aware that you failed an FDA inspection. Lucky you, we didn't catch you, but if we had, here's what would have happened to you. And that may be more effective even than bringing them
Inviting
into a
them to the
meeting,
board meeting.
because it's
Right.
in writing and they see it and they see the connection between the two. For what it's worth.
I mean, I think we can, it sounds like the letter went out already.
The
Or just
letter
get-
went out from the FDA. FDA.
No, but from us, no.
Oh, we don't send a letter. What I'm saying
Okay.
is Pari was there a month after this happened. So
Yeah.
he went through it. If this had been us, this would have, he went through
Yeah.
it with them. They've already been spoken to by,
So I think we can do both. I think we can send them a letter, and as part of that
And-
letter,
invite them to a
We-
meeting.
Yep. They may not come, but at least then it's on a posted agenda that this is happening.
And you have it in your file that you put them on notice.
Yep. Okay. Thank you, Mr. Litt.
Sure.
Okay. So I don't think we need a vote, but we're good on this topic. Next, Metro West Health Foundation Community Health Assessment.
I just wanted to make the board aware of the Metro West Health Foundation. As you know, it's a community. They follow 25 towns locally. One of their thing is to follow health data. They also fund grants for health in our communities. And 2019, they did a community health assessment, and then they did another one in 2023. They did this summer, and they used data from survey respondents, focus groups, and key informant interviews. And 2 weeks ago, they released their findings. If folks are interested, I have more information. But from those 3 sources, they reviewed health priorities and health concerns in our 25 town municipalities. They had mental health, substance use, built and natural environment, housing insecurity, and food insecurity. Our health priorities. Other big mentions were access to care. That was especially seen in mental health, wait times, chronic disease, and health disparities. So that was reported out with some suggestions about collaborative working in our communities, making residents more aware of resources, such as there are behavioral health urgent care centers. There's one in Framingham that's this afternoon. The state did a rollout of this, making residents aware of resources. And in addition, the report from the community health assessment findings was a hard copy that they distributed at the meeting. They also reviewed, which some of this is on their website anyways, health data for each zip code. So there's 2 in Southborough, 1 is small, but these were publicly available, basically data sources that they use, but it was nice that they compiled that for every zip code in those 25 municipalities that they service. So the data was not from the survey per se, but it did include some health indicators, health measures, access to care, chronic disease, and other illness. So there's reports about that for each town or zip code. And that they compare to the 25 town region, you know, if how your indicator is sort of more above or below average, like is our rate of diabetes higher than, you know, our 25 town. And then they also, for some of them, they compare to county, to Worcester County, but they did that in the data for us. If anyone is interested in that. So there were, you know, some indicators through that were sort of above average for our region in terms of some of the healthcare indicators that they looked at.
Great. Do you have any of the information electronically now, or is it all in that?
I think the foundation did, I think they gave these out at the meeting, but I believe, yeah, I can send the board a link to the, I'm sure it's downloadable. The
Okay,
yeah.
thank you. Okay, any questions on that?
I mean, I think some of it will, we, you know, again, inform some of the work we're doing this with the substance use and prevention work.
Mhm. Okay, great. All right. FY25 budget approval. So we have 2 budgets that we need to approve. One is the elected Board of Health budget, which is essentially a stipend for the 3 board members sitting here. It's $150 per person per year, so it's $450. It has not changed since I've been on the board. And most people do not take the stipend. So it's there. It usually just gets, if you don't take it, it gets returned into free cash for next fiscal year. So that's a pretty easy one, unless somebody wants to not have a budget for that. I have not looked at if you are required to legally to have one for an elected Board of Health. We go with status quo on that. Okay, so I'll move that we approve the elected Board of Health budget at $450 for FY25.
Second, and I vote aye.
And I vote aye.
Okay, Malinowski's aye. All right, the next one I'm gonna share. which is the department's budget. Can you all see that? Okay, so Liz, this probably looks familiar to you, because this is the format that all town budgets should be in. I don't know if you actually look at Concom's in this format as a board or not. But it essentially gives you, it doesn't give you the budget numbers in prior years, except for the current year that you're in, because we obviously haven't finished FY24. So it's just the budget numbers, but columns B, C, and D are actuals for what was spent those years. And then FY24 is what was voted at town meeting in March that we're currently in. And then FY25 is the column that they would use for our request for FY25. The changes that I made on here were for SAP employees, and I'll just go to the salary tab for a second. So this is directly from Brian and Carla. I did not change. And my understanding is that there's a 2.5% COLA plus a step increase for SAP employees. So I actually didn't know that when I sent this out to you last night. I wasn't sure what the breakdown was, but that's how those calculations were done. And because I didn't know what the COLA increase was, I didn't change Heather's, because I didn't know what the COLA amount was. So we can update that too. So that's kind of the salary part. And historically, last year was the first year that we actually broke out the salaries into the first line, which is salaries and wages perm. That's Barbara's position. Part-time salaries is the director, that's Heather. And then we actually added the nurse. So without having CARES and ARPA funding for public health salaries this year, this is an accurate depiction of what our full cost is for the employees who are employed by the town of Southborough. The other thing that I wanted to point out to you is row 17, this contracted services line. This is what we pay Dennis out of, and the backup if we need any backup services for inspections. The 64,224 is calced out at 52 weeks. It would be if Dennis worked 19 and a half hours full time. So and that ties out to what the revenue is. So I went back through last night to the last 3 years of revenue for permits and licenses and all the inspectional stuff, and it's 65,000, 66,000. So if you put it into a revolving account, you wouldn't even see the revenue and expense, but the revenue for Board of Health ends up going into the general fund. And so we have the expense in the Board of Health operational budget, but it really does offset each other in the long run. I'm not sure if that made sense to you guys. I can clarify if you didn't follow me. You didn't follow this?
No, I think I'm good.
Oh, okay. So, and then the other expenses I left the same from FY25. I mean, we did increase, or no, I don't think we actually increased any of these line items from FY23 to FY24. It's just that the actuals in FY23 were a little bit lower for the employee training seminars. We didn't have as many trainings to go to. If we do have the opportunity to use a grant to do a training, then we do, as well as any travel costs. We weren't really traveling prior to this. We traveled a little bit last year, but I think we had some covered by a grant. So that's, I mean, it's really not a complicated budget, and I didn't really change a lot or anything actually. Anybody have any changes?
No, it looks good to me.
Looks great. Thank you, Chelsea.
Yeah. So I know we haven't negotiated anything for next year. I think we probably should put in a % increase just to cover ourselves on the budget, and then we can deal with that on the back end if we need to modify it. For Heather's position. She's the only one that's on contract, so it doesn't fall under the SAP, which is why I didn't change it. So you want to just go with the COLA for now and we'll
Yep.
deal with it
That
when we
works.
actually do negotiations. Okay. Oh boy, hold on. I think I just messed that up. That should have carried over. Yeah, it did. Okay. So I'm gonna save this. Okay, so I'll move that the Board of Health approve the FY 25 Department 512 Board of Health budget for a total of $284,218.
Second, I vote aye.
I vote aye.
And Malinowski's aye. Thank you. Okay, next is upcoming meeting schedule. So we have 12/12 at 12:30. Does that still work for everyone? Do we like the 12:30? Do we not like the 12:30? Liz,
Um. Um. 12:30 is a little bit hard for me.
what's
Um,
better?
Wednesdays is better, but you can't do Wednesdays, right, Saptar? You can do like two. What are the days you can do again?
I can do Monday mornings. Wednesdays are touch and go. There's possibility between maybe 11 a.m. and 1 p.m. on some Wednesdays, not other Wednesdays. Virtually, I could do those virtually very easily. So that's definitely a possibility for me. If like Wednesday at noon would
Yeah.
always be open.
That's not good for
That's
me.
not good for
Okay.
you.
For if we could do like 2 o'clock on the 12th, that'd be better
can
for
do
me.
Okay, I can do two.
Thanks.
I'm at the assessors in the afternoon at 2 o'clock.
Okay.
So,
What are the, sorry, what days is it again, Saptar? I know you just said Tuesdays,
Oh, no worries. Monday mornings.
Monday mornings.
Are completely open. And Wednesdays, there's some meetings. I just don't want to be in this situation again where something runs late. So I know that Wednesday mornings I typically am like boggled down till at least 10:30, some days 11. So I just give us some cushion to 11:30 a.m. to 1 p.m. But Chelsea, that doesn't work for you, right?
no, Mondays and Wednesday mornings are Wednesdays are just not good for me.
Yeah.
But
Or
Barbara,
Fridays are not
Yeah.
good.
I can do Fridays.
I can only do I can't do Fridays. That's
Okay.
another between noon and 1 would be the only time I could do on Fridays. So
We all work.
Yeah, we
Short
don't staff.
on Fridays.
What'd you say?
They work till 12 on Fridays.
Um,
Barbara,
Yeah.
do you do the minutes while you watch the meeting?
Yes.
Oh, I was gonna say, I'm happy to run the meeting.
Um,
Can I negotiate with Paul?
yeah. Talk to Paul. I know he's
Okay.
not up there today, but yeah, talk to him
Okay.
because it'd only be like an hour long.
I mean, this is a long meeting for us, so I
Yeah.
try to keep it a little bit shorter.
Okay. Yeah, just
All right.
confer with him just so that he's not
Okay,
blindsided or something, because I can always go down to the meeting room.
okay. So let's
And
do
We're
do
2
it.
o'clock.
sorry, just to confirm, we're talking about Tuesdays at 2.
Yeah.
So that does not always work for us. It
Okay,
happens to work for us this
Yeah.
day.
yeah,
we
Um,
just do it. Yeah, just do it one off.
Yeah, but there's 2 Tuesdays a month that we have a meeting from 1 to 2:30. So
okay,
and then we have meeting at 3 and 4. So
Okay.
as long as
we'll just have to work it on the days that you can do it.
yeah, this one for me is fine if we're keeping it the same day, but sometimes it's not gonna work. Like
All right.
50% of the time it's not gonna work.
So let's do 12/12 at 2 o'clock.
Sounds
And
good.
then let's do January. So Taylor, what Tuesdays can't you do in January?
1 second, let me just update my calendar for this one. January, Tuesday, we can't do the 2nd, which we wouldn't do anyways.
Yep.
The 9th, we're
And
okay.
the 30th we can't do. And the 9th, I have an all day training at public safety, but I could do the 16th or the 23rd.
I'm indifferent on those two. After, do you care? You're on mute.
2 p.m. It doesn't matter to me.
Okay. Liz?
The 23rd is better for me than the,
Okay, let's do the 23rd at 2.
okay,
All right,
Virtual or in
Yeah.
person?
virtual.
virtual.
Might be tough for me, but that probably doesn't matter.
Okay. On the 23rd, you mean, or on the December one too?
Oh, just January 23rd.
Just the 23rd? Okay. All right, and then I'll talk to you, Barbara, offline about
Yep.
how we can make that work. Okay. Thank you. We may need to call a special meeting depending on when the timing of the warrant opens, just to put in the opioid settlement article, but that would just be a one-off.
Okay.
All right.
Good.
And lastly, we have public comment. I lost my thing. Okay.
No,
Mr. Lick.
Yeah, so now I guess I have two things. The warrant opens on December 8th, if I remember correctly.
Okay, thank you.
So I sort of wanted to go back to the flu clinic thing. I think you all probably saw the 2 emails I sent after I attended the last one. I'm just sort of want to encourage you to see if we can't figure out a way to do all-in-one clinics, meaning covering all the respiratory diseases. Because it just doesn't make sense to me that we provide now just the flu, but people are being encouraged to go for COVID. Some of us are encouraged, to go for RSV. And basically what we're telling people is, you can get part of it here, but then you have to go somewhere else, make an appointment and all that for the others. And as far as I can tell, those other places that you go to could also do the flu. So from a point of view of a consumer of this, the current situation just doesn't make a whole lot of sense, because we're not solving the whole, public health, seasonal respiratory disease problem. And so it seems to me that, there's got to be some way to solve the cost problem. The note I got from Heather said, well, you guys had talked about it, but it was expensive. And, it seems to me that, whether from the state or from the insurers or from other towns, there ought to be some way to put together enough money to do the whole job for the public, instead of sort of leaving them with 2 appointments where in years past, before when we had only one disease to worry about, it was only one. So that's my plea for some extra thought on this.
Thank you.
I have to jump from this meeting, but I do want to say I appreciate those comments. I did read your email, and I'm looking forward to see if there's anything that we can formally do to address them. But my apologies, everyone. I have to jump off, but I know now that Saptar's here, we'll still be at quorum, so we're good, right?
We're gonna adjourn, so we're good. Thank you. I call the meeting adjourn at 1:33. Saptar, can you second?
I forgot that we officially, I second the
We have
motion.
to do it. Yeah, go ahead.
And my sincerest apologies. This was scheduled after our meeting and it was supposed to end at my prime meeting was supposed to be only 30 minutes. So my
Don't worry.
serious apologies. Heather, I couldn't even text you in between it. There was a bunch of people talking about budget and vision. And I was like, oh geez, I can't even text Heather. So thank you, but sorry about that. But
No worries.
last minute. All right. Bye.
All right. Can you second?
Second the motion and vote aye.
All right. Malinowski, aye. Have a great day, everyone. Thank you.